Hi, I'm Brittany Montez, and this is the Orlando Health News Review for December 13th. We're back with the next episode in our Orlando Health Key Behaviors video series. Last month, you learned more about the key behavior connection. Now let's take a deeper dive into communication.
Hello everybody, it's Heather again, and this month, December, we are going to sit down and talk about communication. I'm joined by Keena Lewis. I'm so excited to have Keena here. She is a gifted communicator and is responsible for a lot of the communication here at Orlando Health.
You can watch the full conversation on Swift. And you may have recently noticed new wall art going up in team member entrances and break rooms. Thanks to a generous donation from the Orlando Health Foundation and in partnership with the corporate Your Best Place to Work Committee, facilities across the Orlando Health system will be receiving enhanced welcome signage and message boards with the purpose of uniting and inspiring our award-winning team.
The goal of the Your Best Place to Work Committee was to provide an engaging, welcoming, and consistent entrance and break room experience for our team members across the Orlando Health system of care. With these new panels, sites will be able to write encouraging messages to team members, share letters of appreciation from our patients and the community, and post important organizational and well-being updates. Panels are currently being installed in all Orlando Health hospital facilities, and plans are underway to bring these panels to sites across the system in the new year.
And beginning in January 2024, Orlando Health will introduce on-site dermatology services via OnSpot Dermatology for team members at Orlando Health and Bayfront Health who are on the team member health plan. OnSpot Dermatology is a mobile practice that will bring full-service dermatology care and treatment right on campus. Skin cancer screenings can be completed in about 15 minutes, and appointments are made directly with OnSpot Dermatology.
Skin cancer is one of the most common cancers we deal in this country. It's about 3 to 4 million cases a year, and most of those cases are seen by the dermatologist. And often we can actually see precancerous lesions, like actinic keratosis, for example. But imagine if we caught these things earlier for a stage 1 melanoma, where the cure rate is roughly 97–98%. So earlier diagnosis, early detection is always best. And now with the OnSpot Dermatology Group, we can do this much easier and more convenient for our team members.
Check Swift or click the link above for details. And Orlando Health Jewett Orthopedic Institute is making good on the promise of a new level of orthopedic care, announcing that it's one of the first in the nation to offer artificial intelligence assistance in hip replacement procedures to optimize patient recovery and mobility following surgery.
One of the most common reasons for dissatisfaction after hip replacement is if you don't get the leg lengths exactly right. You can imagine if your leg's a ½ inch long, you're not going to like that. And also the biomechanics of the hip. It has to be put in right so you have good range of motion without things like a dislocation. And also the wear of the hip. You wouldn't put a tire on your car and leave it malaligned. So having the hip replacement put in to the millimeter and to the degree of where you want it, based on our simulation modeling for the particular patient, and then confirming that right then and there in the OR with the artificial intelligence is amazing. Not only can I plan your hip specifically to you, not a one-size-fits-all, I can ask you what your activities are that you like to do. Are you a golfer? Are you a yoga instructor? Then I can plan the target, I can hit the target, and right there using artificial intelligence, I can confirm with a digital x-ray right in the OR immediately. Not only is the surgery more efficient, it shortens the overall length of the surgery, so you're not under anesthesia as long, and you can go home the same day knowing your hip's implanted accurately.
And here are a few dates to know. Check out Swift for all the details. Well, that's it for today's edition of the Orlando Health News Review. We'll see you next week.